Assalamualaikum. My name is Nur Hafizah binti Mu'ta. My matric number is 2020492232. Today I will present about introduction and acquisition and collection of record. Record management is the administration of records and documented information for the entirety of its life cycle, which includes creation, maintenance, use, storage, retrieval, and disposal. The goal of records management to help an organization keep the necessary documentation accessible for both business operation and compliance audits. Acquisition can be defined as the process of identifying and acquiring by donation or purchase historical materials from sources outside the archival institution. Penn's hospitals now extend from Lancaster to Princeton, but Penn now faces a number of rising competitors, including Jefferson, UPMC, and IMR. Hybrids of health system and insurers have worked their way east, and UPMC's joint venture with Tower Health to offer health insurance brings the Pittsburgh giant all the way into Philadelphia. The University of Pennsylvania Health System on January 1 completed its acquisition of Princeton Healthcare System. The University Medical Center of Princeton in Plainsboro will be rebranded as a Pennsylvania Medicine Facility. Pennsylvania Hospital's Historic Library, the first medical library in the United States, was begun in 1762 as a teaching and reference library for the hospital's managed physicians and medical students. The Pennsylvania Hospital Historic Collection is currently revising its patent record access policy for all medical patent records held in the archive. There is 5 collections in the Pennsylvania Hospital Historic. First is Gallery Pavilion. Second is Great Court. Third is Historic Medical Library. 4 is Surgical Amphitheater, and 5 and 5th is Physic Garden.
Appraisal and disposal. Only few things been discussed about the appraisal and the disposal process of the archive collection in the Pennsylvania Hospital Archive website. This is because basically the appraisal and the disposal process had been done by the record repository before its transfer to the archive. Surely, only the record that contain archival value will be kept in the archive permanently. However, the disposal process need to be done if it was asked by the authentic person, referring to the federal and the state regulation. Without doubt, the material that's sent to the Pennsylvania Hospital Archive to be sure has been evaluated for its value, and it already been evaluated based on the function of the archive to the medical field. Those archive collection evaluate in terms of its future use. Since the hospital archive more to the mental disorder treatment, most of the collection probably cover on the psychological disorder, and mental illness treatment must be kept because it might be useful for the future medical reference.
I will explain one of the activities of archive, which is accessioning. Accessioning is the process of formally accepting materials into archive. The process enables the staff to control the materials. Accessionings provide information necessary to maintain accurate and up-to-date inventory control over the storage of archive and manuscript. During the printed process was created, the Historic Library accepts the nation's collection of medical books published between 1715 and 1815. Until now, historic materials are used periodically for research and medical exhibitions. Next, I will be explained in the terms of arrangement and description. Arrangement is a process of reviewing a record to find out how it relates to the system created the records. For the description is a process explaining the arrangement so that people such as administrator, researcher or other can know where to find the material is. It makes the finding easier and faster with the correct findings. Not just that, Pennsylvania Hospital also provided catalog and finding aids available to use. The users can access finding aids that have been processed since 2002. That's all from me.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nofikrah binti Muhammad Saleh. I will continue with the next slide, which is preservation and storage. The Pennsylvania Hospital, focusing on collecting and maintaining the hospital's historic artifacts and memorials collection, includes hundreds of diverse medical artifacts such as antique surgical kits and World War I scrapbooks from hospital nurses. Besides of that, they are also preserving patients' records and other vital records that related within the organization, which include board of manager minutes, admission and discharge record, administrative and financial records, personal correspondence of physicians and superintendents, and other record of charitable organization. Doctors must keep medical records for 7 years after the last day of treatment date. Minor children must be kept for 1 year after the age of majority for 7 years. The Pennsylvania Hospital also retained their adult patients' records for at least 7 years from the last date of service.
Access and reference service. In accessing and reviewing the archival material, the client had to make an appointment first. The appointment can be done by sending the email, or they can call for the library service number, and the research can be done on a Monday to Friday from 9 a.m. to 4:30 p.m. For the best, client can take a look on the finding aid to know what kind of collection provided by the Pennsylvania Hospital Archive. If the client would like to see the image collection, client has to pay for the service charge, publication charge, republishment charge, and so on. In addition, anyone who needs photo reproduction service must make a written request and send it to the hospital archive at least 3 weeks before the required date. Right now, the public are restricted to have an access to the medical patient record. The Pennsylvania Historic Collection is currently examining the policy on the access to the patient record that were kept in the archive. Their new policy will be published on their website as soon as possible. For reference, the archive about the patient record will not be open for reference until the material reaches the age more than 75 years. Besides, the patient record which doesn't related to the mental health will close for 100 years from its creation. After those 100 years, it will be open for the researcher reference. while for the material related to the mental health problem like madness, hysteria, lunatic, and more were restricted to the public, and maybe certain archives still cannot be accessed after reaching that specified years due to few limitations. Furthermore, they might have a restriction for certain archives. This is due to the physical condition of the archive, copyright issue, and a donor restriction, and some archive collections are inaccessible or cannot be published to the public. For instance, the request that consist of patient images are not allowed to be viewed unless the face was blurred.
Next, I will continue with the next slide, which is outreach activities. Outreach activities is an effort, action, to bring services or information to people based on particular activities, to give talks, give knowledge, public lectures, and many more to people where they live or spend time. The Pennsylvania Hospital also planning and making to do a lot of new avenues to provide information and give better support for community in every health aspects for children, adults, and also for the old folks. The Pennsylvania Hospital's aim is to give the best services and treatment of health care to people with various ages that includes children, kids, to adult, and also for the old folks that provided within the hospital.
Assalamualaikum, my name is Nuri Nadira and I will proceed about SWOT analysis. SWOT analysis, which is strengths, weaknesses, opportunity, and threats, is a framework for evaluating a company's competitive position and developing strategic plans. The company's strength is defined as its internal positive characteristics. Penn Medicine has consistently ranked among the top 10 best employers and best states for healthcare in America. It has worked with the most influential companies in the country. It has been at the forefront of innovative, better patient care for many years, and it continues to expand its many centers of excellence. Penn Medicine is also the region's first medical system to get all of its participant hospitals accredited as primary stroke centers by the Joint Commission. They have the most advanced research and incredible discoveries that are advancing the cutting edge of medicine, converting chemistry into cures and treatments to help their patients live longer lives. Furthermore, Penn Medicine's internationally recognized doctors are collaborating with Lancaster General Health's top doctors across specializations to enclose each patient with the strongest team possible, focus solely on healing and returning them to the life they want to live. They create one-of-a-kind treatment plans that are uniquely tailored to their patient by learning about them rather than just their disease. Their hospital provides a healthy and safe environment for their patients, staff, and visitors with no smoking and no weapons anywhere, including outside buildings. Penn Medicine's commitment to continuous professional development is reflected in an extensive list of benefits, which includes prepaid tuition assistance that is among the best in the region. Competitive salaries, paid time off, retirement, and more. Second is weaknesses. Weaknesses are negative factors that diminish our strength. To be competitive, we may need to improve on several fronts. Pennsylvania Hospital has several flaws, including the fact that all three of its hospitals are located in inner cities, with a high proportion of uninsured and underinsured patients. They also enable to reduce hospital costs because they have been subjected to competitive environment tensions. The level of hospital performance at Pennsylvania Hospital in healthcare services, as well as the effect of competitive market on healthcare quality, have remained unknown. During the years 2005 to 2012, the hospital's efficiency has decreased. The hospital is also a teaching hospital system that is impersonal and does not protect patients' privacy. The third one is opportunities. External factors in the business environment that are likely to contribute to success are referred to as opportunities. Pennsylvania Hospital fosters a culture of collaboration and career development, with numerous career opportunities for doctors, nursing staff, experts, a variety of other healthcare workers, administrative and support personnel. Penn Medicine's workforce enjoys a package of biggest advantages, including a generous company retirement plan and a robust student fee motivation program that has offered workers with huge amounts of money in welfare advantage. They also provide top-tier healthcare plans with access to the same advanced care that has helped Penn Medicine become a government leader in healthcare services. Furthermore, their teaching staff, employees, as well as learners are compelled to use their skills and knowledge to help others by providing free medical centers and checkups, disease prevention knowledge, career development in medical services, and counseling services for patients and families. The last one is threats. Threats are external factors over which we have no control. We must think about contingency plans for attempting to deal with them if they take place. Penn Medicine faces several educational threats, including competition from another teaching hospital in the area, which is Mercy Health System. They also have rising healthcare costs as well as a high proportion of uninsured and underinsured patients. Furthermore, due to increasing pressures, Penn Medicine experienced a workforce shortage in 2014. So that's all for SWOT analysis. To conclude, since the mid-70s, the Pennsylvania Hospital archives have documented the evolution of healthcare and public policy. It is because they have constantly ranked among the top 10 best employers and best states for healthcare in the United States. For many years, it has also been at the forefront of innovative, better patient care, and it continues to expand its many centers of excellence. Board of Managers minutes, admission and discharge records, administrative and financial records, personal correspondence of doctors and superintendents, and records of other charitable organizations that were absorbed by the hospital comprise the vast majority of the material. The archive also benefited from National Library of Medicine grants in the 1970s in terms of arrangement, description, and preservation. Furthermore, the hospital archives are an unbreakable series dating from 1751 to 1978. They offer students studying the history of hospitals, healthcare, and medicine a one-of-a-kind resource.